Madam Secretary, welcome. Thank you for being here. Thank you for your help on Basic Health Plan. Appreciate that very much. Also, thank you for the President's budget as it relates to $1 billion for mental health programs for substance abuse and mental health services, and $460 million for the mental health block grant services. I think that will go a long way to helping states deal with these issues. So very much appreciate that. Wanted to follow up on my colleague from Pennsylvania's question, particularly as it related to graduate medical education. This is a big issue for all of us in the country, obviously, with the shortage that we are looking at, something like 90,000 specialists and primary care physicians by 2020. For us in the WWAMI region, Washington, Wyoming, Alaska, Montana, and Idaho, we are even below the national average now, so that's why we care so much about this issue. When it comes to figuring out the impact on, he mentioned Children's Hospital, which I could say that probably the same about Seattle's Children's Hospital, but the issue is also trauma centers or burn centers like Harborview Hospital. So when you look at this reduction in indirect medical education, it impacts that workforce. They have residents there that they're not reimbursed for under the Medicare model. So how do we look at this issue when there's specialized training that goes on at these trauma centers? They want to get their graduate medical. How do we look at this and make sure that these facilities can keep running and operating during this time period?
Well, again, Senator, I think certainly the training of new doctors is of critical importance, and we know what an important role graduate medical education funding through Medicare plays in that training, which is why I would say even in these very difficult budget times, there was an attempt to make sure that we were funding the direct costs, as well as doing some additional look at where there were real gaps in services. A lot of the workforce analysis looking forward indicates that it is in primary care providers, gerontologists, others that we often have significant gaps so we have not only tried to have a budget that supports the direct costs of graduate training, but also shift some of the unused GME slots from areas that may have been more focused on specialty care into primary care, pediatric care, gerontology care, hoping that the effort to address people's preventive care needs at the front end will be met with a healthcare provider. So we would be interested in working with you and hearing from you about the impact of this on a critical center like the burn center and the trauma centers that you have in your area.
Thank you. We'll get you some information on that. I don't know that that's the intended consequence, but I think people are concerned that that will be the intended consequence because those costs aren't covered. So maybe there's something we can do there. And if you could comment too, you know, University of Washington, we train so many primary care physicians. I think we're the #1 in the nation, but we're also very high on the list, you know, in the top 5 of institutions with NIH funding. So this NIH budget issue is a very big issue, and we understand what you've done. Obviously, you know, these institutions were looking for, you know, hoping to get closer to $32 billion than $31.5, and you think, okay, well, that's close. Why does that, what's the difference? Why does that matter? Well, for us, the total economic impact for research, you know, 8,800 jobs and $470 million in wages. So this will be a big impact to us. So, in fact, one of our professors was quoted in the Wall Street Journal as saying, quote, "People are asking me whether I should leave science," end quote. So, given what's already in the budget and what's being discussed as far as sequestration, are we having a chilling effect on this investment in science, and what can we do to help mitigate the sequestration's impact on NIH funding?
Well, I think that the president has proposed a budget going forward and a way to have a sustained and balanced approach to both reducing the deficit, but making some of the critical investments that we need to make. And actually, the budget anticipates
And
removing
we're all
sequestration.
cheers. I should just add, sorry to interrupt, but we're all cheers about the magnificent contribution for brain research. Thank you.
Well, and I think that's an example of the president's belief that we, cannot cut our way to prosperity in the future, that we must invest, and certainly scientific research is one of the most critical investments to keep the innovation and research at the front end. So he very much supports outlining the mapping strategy, which could have a huge impact not only on cures of the future, but when you think about health costs related to everything from autism to Alzheimer's, and if we want to really get our arms around what's happening to health costs in the future, this kind of brain mapping has an enormous impact. And as you say, I think Dr. Collins estimates that there's about a 7-to-1 return, that every dollar in research grant generates about $7 in economic activity in the community where those research grants end up in terms of jobs and scientists. So this is clearly a win-win investment that the president very strongly believes in and supports.
Well, I hope as we continue to talk about and see the impacts of sequestration, the administration will speak out on this, because it's a very short-sighted approach, particularly when it comes to the NIH budget, and I hope that we can get organizations and institutions, whether it's the Institute of Medicine or others, to put pencil to paper and really measure this, as you just did with that 7-to-1 ratio. But we may be saving a few dollars now, but it will cost us millions, if not billions, more if we don't continue the investment in research. And so I hope we can make that point to our colleagues here. Thank you. I think Senator Portman, you're next.